Hi guys, I'm just going to be talking about if a patient comes in with hematuria to a urologist. So the first thing that's going to happen is the urologist is going to do a physical examination as well as checking their patient overview of past, examinations, and then as well as going over their current situation, which in this case would be hematuria. And there's two different ways you can differentiate it, whether it's microscopic or gross. So microscopic, you will only see the presence of blood in the urine with a microscope, whereas with gross hematuria, you can see it with your own two eyes. The urologist is going to ask about symptoms, and this could be urinary frequency, any, blank pain, or history of urinary tract infections would be huge ones. And then they're going to ask about nephrolithiasis or trauma, and they might even assess risk factors that may involve like smoking or, pregnancy or whatever it may be. And then for the next step would be laboratory testing, which starts with the urinalysis, and this is really just to confirm the presence of red blood cells in the urine, and that will detect anything like proteinuria, bacteria, or urinary casts. Any of those may indicate renal pathology or even infection, and a urine culture would be the next step to identify any bacterial infection that may be present in the urine. And after all of that, the next situation would be to evaluate the renal function and renal clearance. So blood tests such as serum creatinine and blood urea nitrogen are then ordered, and these may help determine how effectively the kidneys are filtering waste. In addition to that, the glomerular filtration rate can be calculated to provide a more accurate assessment of kidney function, and imaging studies are then used to identify the source of bleeding within the urinary system. A CT urogram is commonly used for that detailed imaging of kidneys, ureters, or bladder, and an ultrasound will then be used to detect anything like kidney stones or any masses or structural abnormalities, especially when radiation exposure needs to be at the lowest it can be. To directly visualize the lower urinary tract, a cystoscopy is often performed, and this just allows the urologist to examine the bladder and urethra for any abnormalities like inflammation, tumors, or lesions. So at the end of the day, anything with diagnosing hematuria involves a combination of patient history, urinalysis, renal functioning tests, and imaging studies of the kidneys, ureters, bladder, and urethra. And this approach will just help determine whether the cause is an infection, maybe even kidney stones, or even something more serious. So thank you for listening.